Why do 100% of medical students need to know about the popliteal artery? Because it keeps your legs alive. The popliteal artery, located right behind your knee, is the lifeline for your legs. It branches out into several arteries that keep your knee joint, muscles, and foot well supplied with blood. First up, the genicular branches. These include the superior medial, superior lateral, middle, inferior medial, and inferior lateral genicular arteries. They're like the pit crew for your knee, ensuring smooth movement and flexibility. Then we've got the terminal branches. The anterior tibial artery takes care of the front of your leg and becomes the dorsalis pedis artery in your foot. Meanwhile, the posterior tibial artery, along with its sidekick, the fibular artery, looks after the back and sides of your leg. These arteries work together to form an anastomosis around your knee, ensuring there's always a backup plan for blood flow. So next time you're on your feet, give a nod to the popliteal artery. They